Right, news coming in from Karnataka, where the state government has made mask mandatory starting today. This is in public places. However, no penalty has been issued so far. This comes after Chief Minister Bommai chaired an emergency COVID meeting as the numbers go up. So Karnataka becoming another state that has made mask public mandatory again in public places. Delhi was the first to do that, and because one state after the other are witnessing COVID cases rise, and in the wake of this development, the Chief Minister chaired an emergency meeting. All right, so this is the latest as far as the situation in Karnataka is concerned. Remember, this evening, Tamil Nadu is also going to take a call on its COVID protocol. Chief Minister Stalin is also expected to chair a meeting. But the latest coming in from Karnataka is that the state has issued an advisory, and two major decisions were taken in this emergency meeting that was called by the Chief Minister. One, that masking is the need of the hour. It has been mandated in public places and indoors where groups get together. The advisory also asks people to avoid gatherings. And the second key decision is that those above 60 years and eligible must take booster doses. This is important, and those above 12 years also must take precaution doses. So this is the key takeaway as far as the emergency meeting of Karnataka is concerned. All right, for more on this, I'm joined by Neha on the broadcast. Neha, thank you for joining us. While we were sharing this information with our viewers that Karnataka has once again advised people to wear a mask in public places and to avoid gatherings. What is the latest as far as the COVID status in the state is concerned, and the advisory that has been issued after that emergency meeting?
Well, Archana, key decisions that have been taken today by the Karnataka Chief Minister as well as the Health Minister over here. The first of all being that masks are now going to be mandated again in the state of Karnataka. Let's tell you, initially there was a lot of confusion about whether the masks are mandatory in Bengaluru city and in Karnataka or not. However, the government has now come forward and clarified that, masks will be mandated, especially in public places and where indoor events are being held. An order to this effect also would be issued. And the second decision also being the fact that, in order to ensure that vaccination is, ramped up to its maximum, the government, of course, again would be issuing an order today to urge people above 60 years of age as well as those, in fact, who are eligible for their doses to come forward and take their doses. Now, a couple of other things, that we asked the Health Minister on whether they're likely to see more restrictions being put in place right now. He said a call on that would be taken after the meeting with the Prime Minister. But one important aspect, of course, that was mentioned by him today was the fact that all of those people who would be arriving in the state from countries that have been severely affected. Now, he said that one of the countries, for example, Thailand, for all people who would be coming in from Thailand and other countries as well, they would be tele-monitoring these people, and they would, in fact, be ensuring that if at all these people do develop symptoms during their, time over here in Bengaluru city, then they would immediately be admitted to a hospital. Now, this apart, also as far as the, bordering states are concerned right now, be it Tamil Nadu or Kerala, we did see even in Tamil Nadu, in IIT Madras, how there was, an increase in cases that was reported. So, if at all the need does arise for that as well in the coming days, then the government would, in fact, start to scrutinize and start to sort of check people entering from the bordering districts and from the bordering states. So, for now, what we do know is that masks have been mandated again across Karnataka. And secondly, also the fact that all those who haven't taken their vaccination are going to now be mandated to come forward and take their doses. Back to you.
Right. Thank you, Neha, for those updates.